It is Movember. Dr. Jay Nyack joins me right now to tell us all about the amazing things that the Men's Health Clinic is doing here in our community. And Doctor, when we talk about the demand, you guys are certainly seeing it.
Oh, absolutely. We've been open since 2022, and I was just mentioning earlier, we've had about 100,000 patient visits, and it just goes to show that there's a huge need for that service in the province.
Mm-hmm. And when it comes to that, this is super broad, so it's even challenging for me to ask you this question. Tell us about the landscape of men's health in Manitoba.
Oh, that is a very broad question. But, you know, I think in the clinic, we see everything from infertility to prostate cancer. And with prostate cancer, everything from early detection to treatment for patients later on in the life cycle of prostate cancer, meaning later in the disease history. So we see it all. And all of these issues are so common. I think with the clinic being open, it's really created a safe space for men to come with these questions and these issues, because prevention and early detection is key.
And what are some of those early signs?
Well, it depends on what we're talking about, but with prostate cancer, which is very common, 1 in 8 Canadian men are going to be affected in their lifetime. Sometimes it could be as simple as peeing issues, and that's a pretty common thing that men experience as they get older anyway. So how do you differentiate between prostate cancer and just normal, non-concerning peeing issues? And that involves a checkup with your doctor, a blood test or a finger check, for example.
And when it comes to pushing people to go to the doctor, not everyone does it right away. So what would you say about that, and even just continuing to spark the conversation?
Well, and this has been great about Movember. It's about having that conversation. It's about acknowledging that it's okay to take care of your health. But as it pertains to that particular issue with men not going to the doctor, I think the message to men is avoidance isn't going to make the problem go away. Sometimes it can be as simple as just having a conversation, and early detection, as I say, is critical.
When it comes to Movember and people either donating or people even chatting about mental health, why is that so important to you guys?
Oh, it's just so critical, because a lot of times it's just easy to address if you have the conversation early. So book an appointment with your doctor and spark the conversation.